Haley Wright. I must have missed the segment on if K2 removes calcium from the arteries. What is your opinion? Studies. Here's the thing. Again, everybody gets so focused on calcium in the arteries. I will tell you, I've seen 3 patients over the past week who went through this same transition. A coronary calcium score is very important. It's one of the better studies. But there is no really good study for heart attack and stroke risk. Clearly not stress tests. I mean, that's what Tim Russert had a few weeks before he died from his heart attack, and he passed it in flying colors. And there's a good reason for that. Look it up at the Princeton Longevity Institute and Harvard and several other places. We all know that 2/3 of heart attacks occur in people that don't have enough plaque to change the blood flow. And if you don't have enough plaque to change the blood flow, you're not going to have a change on your stress test. So then people will say, well, I know that having a positive calcium score puts me at risk. The higher the calcium number, the higher the risk. That's true. But next, you start to get into the misperceptions associated with calcium score. Calcium is not the same as soft plaque. In fact, a calcium score does not show soft plaque. There is a good correlation. The higher your calcium, usually the more risk you have. However, there is a very significant exception to this rule. I've seen it 3 times this week. It's not rare. It happens all the time, especially as you start taking control of your health. Here's the classic scenario. They're overweight. They know they're running some risk, but it is what it is. I'll deal with it next year. Their brother has a heart attack. So they say, dang, my brother had a heart attack. I really got to I've got 20, 30 pounds I need to lose. Well, he did get a calcium score, by the way. The calcium score was 600. He went on a keto diet. He lost not only the 20 pounds, but 15 more. He lost like 35 pounds. Then he did another calcium score. Anybody want to guess what his next calcium score was? The first one was 600, lost 35 pounds. It went up to 1,400. Now, does anybody want to think that losing 35 pounds put this individual at greater risk for heart attack and stroke? No. And that's only one of 3 patients that I've seen this week alone with a very, very similar story. So don't get too wrapped up in the concern that, quote, calcium is bad. No, calcium is not bad. The more calcium you have, it indicates the more times you've been through this inflammatory process. And as we age, very few of us escape ever creating any calcium in our arteries. It's just harder and harder. The older we get, the more and more resistant our insulin receptors become to insulin. So don't get too wrapped up in that calcium score. Remember that health is not exactly the same as calcium. I hope that answered your question. I do think that K2 has a positive impact on health. I do think that calcium is not really part of the issue. I think, as I mentioned during the program, K2 has an impact on our insulin resistance, as we talked about with osteocalcin and matrix glyprotein, those things that are related to both insulin resistance and calcium deposition. Now, here's another thing. This individual that I talked about wanted to make sure that he got rid of that 1,400 of calcium, and he wanted some coaching from me. And I'm not going to make stuff up because I don't want people to get disappointed again. We need to come to grips with the reality that very few of us actually reverse calcium. We don't tend to get rid of it. Some of us have. John Lorscheider did. He had a huge decrease in calcium. Jerry Kurth did as well. John had like 60% decrease. Jerry had like 15%. Those guys are rare. They're unusual. You can get some decrease in calcium in your arteries, but that's not the goal. It's okay. It's okay if we don't decrease calcium. What we do want to do is get rid of our soft plaque. That's a very practical goal. All of us can do it. And guess what? I've got the vast majority of my folks getting there, getting rid of soft plaque. So thank you for the question. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT, and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs, we go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.